The Community Resource Inventory Service for Patient e-Referral, CRISPeR, was created to allow providers to easily connect patients to community-based resources. Providers can search for resources, make referrals, and receive feedback reports, which closes the communication loop and gives a healthcare provider a better picture of the care and support the patient is receiving outside of the healthcare setting. Mile High United Way 211 connects with the community-based organizations to update or add their information into the Community Resource Inventory, CRI, to allow the healthcare provider to query the Community Resource Inventory and provide a response of the community-based organizations that are able to meet the identified need of the patient. The healthcare provider sends an electronic referral to the referral hub at Creo by selecting the CBO and submitting the referral. The referral hub identifies the CBO and forwards the referral based on how the CBO wants to receive the referral. The CBO connects with the client and enrolls them into their program and provides periodic progress reports through the referral hub, which then routes the progress report back to the referring provider, completing the closed-loop referral process. CRISPR is currently being used to refer patients with prediabetes to community-based diabetes prevention programs with the intent of expanding to additional health and social determinant of health use cases.
So CRISPR is a great example that is a system that is already in the works and is being further developed to support what one of the subgroups of the Office of eHealth Innovation or Care Coordination Work Group, which feeds into the Health States Health IT Roadmap. And CRISPR is a use case, in essence, of how care coordination can be developed and actually operationalized for individuals to be better connected to care and resources in their community, and to be a mechanism for different agencies to have an understanding of what is happening with an individual versus just providing a referral to an individual and not knowing what happens to them after the fact.
We're trying to solve this age-old problem. As a family physician, I would see families and individuals in different types of need, but have very little idea what to do about it. You might say to somebody, this person has a hunger need or a housing need or a transportation need, and never find out what happened or how it might have been managed, what might have gone wrong if no change occurred. So what we see in today's CRISPR is the ability for me to perceive a need, find a resource that is for whom the patient might actually be eligible, and that is a huge issue, and make a referral without both a great deal of difficulty looking things up in databases that I'm not familiar with, etc., and at the same time getting some degree of information flow from me regarding the need to the service agency I'm referring to and back again. Closing that loop is a radical change.
So prior to CRISPR, it was much harder. We really worked with the community-based organizations individually and would find out some of the DPP programs that they're offering, and we would let our patients know about the program, and we would manually send the referrals via fax. So it was much more, it wasn't nearly as streamlined as it is now. It definitely took more work to see what's available in the community, whereas now when we have the 211, it's very easy for us. We just click a button and we can go by the patient's zip code and see which programs are available for the patient in the community. And we love that this is up to date, so it takes the research out on our end for seeing which programs are accepting patients right now, and which programs are closest to our patients. So it's been a wonderful resource.
We may not know what resources in our community could benefit this individual patient, and if we help connect the patient to a resource, we're oftentimes left wondering whatever happened. CRISPR provides a revolutionary opportunity to change all of that. It allows a provider or any healthcare team member to use information from the medical record, including the patient's social determinants of health information, and to link them to a community-based organization or program that could help that specific patient and that specific social determinant.
I think with the provider coming from it, it gives a stamp of importance and realizing of their health benefits. Along with that is there's some reinforcement of behavior change. It's more than just this is something I should do, but it's something that my doctor's pushing me to do.
A referral can be electronically placed and sent to that resource from within the EHR, and then the community resource can send information back to me, the patient's primary care provider. CRISPR changes dramatically how healthcare providers can integrate with their communities and all of its resources. It allows us to function in new ways as a health neighborhood. It creates the capacity for us to improve health in meaningful and powerful ways.
The CRISPR search and response process has been integrated into electronic health record systems. The EHR you will see in this example is next-gen. Other EHRs will look different, but are set up to function the same using standard health information exchange protocols that all certified EHRs support.
To begin, staff navigate to our referrals template. From here, they'll select the e-Referral radio button, and we'll select our CRISPR community resources. To initiate the 211 search, we'll click the link here, which will return DPP programs in the patient's area. I'm going to be using this one, sending to location 101. My resource type is diabetes prevention, and the resource ID was 101. Now I can click place order and send, which will generate a CCDA document and send it electronically.
From our provider perspective and within our health education department, we always want to know, what is happening with the patients? How are they doing? And so perhaps a patient had a medical visit, they were contacted by the DPP program, and maybe 3 months later they have a follow-up visit. Then we know that the community-based organization has contacted the patient. Perhaps they've enrolled, they've been enrolled for 2 months. And so for us, it's extremely helpful because we can provide support for the patients and encouragement and just encourage them to continue their journey on this program. And then we can reference that in the visits as well. So it's extremely helpful because the provider can see that, oh wow, you're working with the DPP. It looks like you have lost 10 pounds in the DPP. Congratulations. How are you liking the program? So we find that both the providers and patients are much more engaged.
When they access the patient's chart like I'm in right now, we're able to see all of those summaries in a category view under transitions of care. Here I can click on the most recently received document, and after it loads, I can see information that came from that program, such as vitals, BMI information, or any other notes that have come through. So here I can see that the patient showed up in person, the date that they attended, and this information. Now that I've reviewed the info, I can send communication out to my care team by going to what we call a telephone template and then sending that information to a case manager. And send that off to Isaac, who is my case manager. Now that communication is part of the patient's health record. If they were to call back, we can see what we're doing, and all of our other care team members can see that the patient has also gone to the DPP program.
CRISPR wouldn't be possible if it wasn't for our key partners, Creo and Mile High United Way 211. 211 is the partner providing the community resource listings of the CBOs that have been onboarded to participate in the closed-loop referral system. Creo is the HIE partner providing the electronic capabilities to send referrals from the health information systems to the CBOs, while also being able to receive the progress notes from the CBOs that are sent back electronically to the health information systems.
It's a comprehensive compilation of community services and resources that are available to the public, both locally, regionally, and throughout the state. It's a library of about 7,500 services that meet a wide variety of individual and family needs. The 211 CRI is continually updated and personally vetted by our staff to make sure that the information is timely and accurate.
What are we building at a foundational level that enables those local communities to have the information they need, the infrastructure that they need, to plug in the different tools that they might need, and tools that can help accommodate that are sorely needed, particularly when we talk about not only underserved urban areas, but also rural areas where resources are just scarce to start with. Being sure that people can appropriately access and plug into those, I would hope is where this is at in 2 or 3 years. That providers are able to use it in a way that's meaningful, and patients are able to benefit from it in a way that's meaningful. That we do see an uplift in the digitization of community-based organization processes, so that we can bridge that divide. And I think CRISPR has the ability to be that bridge.
Our referrals went from about 10% of our enrolled participants to about 40% within the last year. So a huge increase in referrals coming from that aspect. Thinking about, for us, it's a big piece of its sustainability, thinking about how does this program go on for a long period of time, and realizing that we know that the need is high for prediabetes and people transitioning into type 2 diabetes. So the CRISPR project has allowed us to increase our reach. It's creating this bidirectional sharing of information so that it's a partnership. Both sides are working to just better serve our community and our patients. So the value is huge, and for us here at the Y, it's only exciting about how do we tie it into our other programs, like our blood pressure self-monitoring program or our Live Strong cancer survivor program. So other opportunities of how the community can help with the heavy load that physicians and those partners have to carry.
There also needs to be sharing of lessons learned, both with what's happening within CRISPR, knowing what's happening with other referral projects across the state and nationally, so that we're all working in concert to advance this realm together. Technology is also another way to think about communication. There are multiple different platforms that multiple agencies and systems use, and trying to figure out how those different platforms talk to each other or their interoperability is very key to the success of CRISPR. And then lastly, continually thinking about the future and bringing up different considerations or what ifs so that the system can be built in a way that is flexible and expandable to address whatever may be coming in the future that we haven't even thought of yet.
Something that works. So I see it as growing to encompass more healthcare providers, more types of health and social issues that it addresses, and serving a larger population over time.
Community-based organization, e-referring to another community-based organization. I see it, or I'm looking for 211 can make e-referrals to community-based organizations. Community-based organizations can make e-referrals to 211. So it's really having everyone kind of connected to a common hub of information to best support their clients easily through e-referral.
If we do this right, people will wake up and not remember how it used to be, how challenging this process was. The idea of being just integrated into the community and being able to connect people to the services that they need will just be how it is. And that, I think, should be the goal.
This is just the first step for CRISPR. CRISPR will continue to grow, align, and collaborate to advance the health and well-being of all Coloradans.